Now, when most people think about gut issues, they picture scopes, scans, maybe a breath test or two. But blood tests, they're often the first step in figuring out what's going on, and they can actually tell us a lot. So let's break down what we're looking for when we send you off for a blood test, and why those little vials of blood are so helpful when it comes to sorting out what's happening in your gut. So let's start with the basics, the full blood examination, or FBE. This is one of the most common tests, and it gives us a snapshot of what your red cells, white cells, and platelets are doing. We often use this to look for anemia, which can be a sign of chronic bleeding, like from a stomach ulcer or bowel polyp, or from malabsorption, which we sometimes see in celiac disease or Crohn's disease. It also tells us if there's inflammation or infection brewing. For example, a high white cell count might point to active inflammation in the gut, like with inflammatory bowel disease. Next up, iron studies. Iron deficiency is incredibly common, especially in women, and it's one of the most frequent abnormalities we see on blood tests. But in gastroenterology, we don't just top up iron and move on. We always ask, why is the iron low? Is there bleeding in the stomach, a polyp in the colon, poor absorption in the small intestine? Low iron might be the first clue that leads to a more detailed workup, like a gastroscopy or colonoscopy. Now, let's talk about inflammatory markers, specifically CRP and ESR. These aren't specific to the gut, but they help us track inflammation. They're especially useful in conditions like Crohn's disease and ulcerative colitis, where we want to know if inflammation is active or under control. That said, not everyone with active IBD has high CRP or ESR, it's just one piece of the puzzle. Another common one is celiac serology. That's the blood test for celiac disease. We usually test for anti-TTG antibodies, that's tissue transglutaminase, and sometimes anti-endomysial antibodies too. If these come back positive, we'll often follow up with an endoscopy and biopsy of the small intestine to confirm the diagnosis. But here's the key thing, for the blood test to be accurate, you need to be eating gluten regularly at the time. So if you've gone gluten-free before the blood test, it could give us a false negative result. So always check with your doctor before cutting anything out of your diet. Let's move on to liver function tests, or LFTs. These check enzymes like ALT, AST, GGT, and ALP, along with bilirubin and albumin. They help us assess liver health, and trust me, your liver has a lot to do with digestion. It processes nutrients, metabolizes toxins, and produces bile, which helps you digest fats. Abnormal liver tests can be a sign of fatty liver disease, alcohol-related liver injury, viral hepatitis, or even autoimmune liver conditions. And then we have pancreatic enzymes, mainly amylase and lipase. These are useful if we suspect pancreatitis or inflammation of the pancreas. Lipase is more specific, and if it's significantly elevated and you're experiencing upper abdominal pain, nausea or vomiting, pancreatitis is high on the list. Now let's talk about nutrient levels. In chronic digestive conditions like celiac disease, Crohn's disease, or after bowel surgery, we sometimes see deficiencies in nutrients like vitamin B12, which is absorbed in the terminal ileum or last bit of the small bowel, folate, which is absorbed in the small intestine, vitamin D, which plays a role in immunity and inflammation, and sometimes magnesium, calcium, or zinc, if there's chronic diarrhea or malabsorption. We don't test these routinely unless there's a reason, but they can help us understand the full picture, especially if someone is losing weight or has ongoing digestive symptoms. Now a bit more specialised, serum gastrin, chromogranin A, and celiac-related genetic testing. These are tests we use in specific cases, like looking for Zollinger-Ellison syndrome, neuroendocrine tumours, or confirming genetic predisposition to celiac disease in family members. Again, not everyday tests, but they're part of the toolkit when we're dealing with complex cases. And of course, if someone presents with jaundice, unexpected weight loss, or persistent abnormal liver tests, we might also check for viral hepatitis, autoimmune markers, or even tumour markers like CEA or CA19.9, though those aren't screening tools and always need to be interpreted with caution. So, if you've ever wondered why your doctor is asking for half a dozen different blood tubes when you say your stomach's been a bit off, now you know. We're not just trying to drain your arm, we're collecting clues. Blood tests help us rule out things, confirm diagnoses, and track your progress over time. They're quick, relatively inexpensive, and often the first sign that something deeper is going on. But they're not the whole story. A normal blood test doesn't always mean everything's fine, and an abnormal one doesn't always mean there's something serious. That's why your blood results are always interpreted in context with your symptoms, history, and sometimes other tests like imaging or endoscopy. So next time you're asked to head off for bloods, don't roll your eyes. Think of it as one step on the road to better gut health. Thanks for watching. If you found this helpful, feel free to like or share it with someone who's been wondering about their test results. And if you've got questions, leave them in the comments and I'll do my best to answer what I can.